Hello, it's me, Stacey Dillon, co-founder and executive director of Connecting to Cure Crohn's and Colitis. Over the past several months, as some of you know, that we have dealt with a complicated health insurance issue involving my son's medication. He was switched off his brand medication. It was a non-medical switch to the biosimilar, and we went through a whole process in order to get him back on the Stelara, which thankfully we were successful in the insurance company reversing the decision. I've had several people reach out to me about how to do this, what to do, and so we've created a resource which will be linked in the bio of our social media, and also we will put it up on our website and we'll let you know when we do that. I just wanted to share some of the lessons and the things that I did, the steps that I took. Everyone should be aware that when an insurance company makes a decision, you do have rights. You do have the ability to file a complaint or, let them know that this is not a good decision. I'm sure many of you know that. But I just wanted to make sure that people understood that you can involve your healthcare team and other agencies to help you with this issue. The other thing is that it's really important to document everything, and you will receive a lot of paperwork from the insurance company about the decisions, when they're going to be making the decision, the denials, all of those things. So just keep track of all that. I have a whole file that's very thick of all this information. The other thing is that obviously you have to involve your medical team, because the insurance company will reach out to them to ask them for medical information about the issue that you're talking about. One of the things that is important is that the doctors and the nurses and everyone in your office or clinic have dealt with this a lot, so they understand the process. And unfortunately, they too have to spend a ridiculous amount of time dealing with these issues. Many clinics, IBD clinics or practices might have someone there that specifically deals with insurance issues to relieve the burden a little bit from the doctor and to get some support with that. The other thing is that there are oversight agencies. In California, there are 2 oversight agencies that oversee insurance plans, and they're the ones that ultimately were the ones who made it possible for the decision to get reversed. So you have to, depending on what state you live in, you'd have to find out which agency that is. I wanted to say that most importantly, you have to be persistent. This process took us about 3 months. It was exhausting, and I do completely understand that many people do not have the time or energy to do this. And so I wanted to be able to help other people figure out what is the best way to do this. If you do have any questions, you can always reach out to us and also look for that resource. And again, I'm fully aware of the capacity that patients and caregivers have. We are the ones managing chronic illness. We are the ones with the chronic illness, and that's exhausting in itself. But the good news is that patient advocacy in all areas, not only insurance, but with medical providers and everything that all of these amazing patient advocates do, is successful and has really helped make things better for the IBD community. So I know it's hard work, but we do make a difference. Thank you.